Good evening. My name is Terry, and I'll be your moderator tonight. Thank you for joining our live interactive telephone town hall. We're hosting tonight's event to give Congresswoman Spanberger the opportunity to speak directly with you and answer your questions about the issues facing Central Virginia families, patients, and healthcare providers. As I mentioned, this event is an interactive forum, and we would love to hear questions from you. We will be taking as many questions from Virginians as we possibly can live on this event. If you have a question, you can press *3 on your telephone keypad at any time, and you'll be placed in line to speak with a member of our staff. They will take down your name and where you're calling from. And then the next time you hear your name, you will be live on the call, and you will be able to ask your question directly. If you're streaming the event on our website, you can simply type your name and question below the streaming player. Additionally, if you would like to receive updates from our office via email, please press *6 on your telephone keypad at any time, and an operator will collect your email address. We could receive a lot of questions during this event, so if we're not able to address your question, please call our district office at 804-401-4110 during normal business hours. Again, if you have any questions throughout the event, please press *3 on your keypad or type them below the streaming player. If you'd like to receive updates from us via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. At this time, I'll turn it over to Congresswoman Spanberger to make her introductory remarks. Congresswoman?
Thank you very much. I appreciate everyone being here tonight, and I thank you for joining me on tonight's telephone town hall focused on healthcare issues facing Central Virginia's families, seniors, and healthcare providers. As we see rising rates of COVID-19 cases and hospitalizations in states across the country, we know all too well that the COVID-19 crisis continues to create crippling health and economic effects here in Central Virginia. Just in the last week, I have heard from healthcare providers about continued challenges getting the PPE that they need, rising prescription drug costs impacting our community's families, and urgent needs for funding for long-term care facilities and community clinics. During this uncertain time, I know that reliable information is important as we work to keep our families and our neighbors safe. And please know that you can always contact my office if you need assistance. Tonight, I am joined by Virginia Health Commissioner Dr. M. Norman Oliver, who will be on the line with me to answer your questions about our response here in the Commonwealth. Together, I hope we can provide useful information and direct you to additional resources for you and your family. I know that many of you are closely following the next steps at the federal level, so I want to reassure everyone on this call that I am continuing to fight for support for our hospitals, our nursing homes, and our local communities. This means also including support for COVID-19 testing in the upcoming relief packages, which Congress will likely be debating in the next few weeks. I know that Virginians are taking this pandemic seriously, and as we move forward, I am committed to continuing to make sure that we take responsible steps forward that protect ourselves and our neighbors, keep our healthcare workers safe, and allow for small businesses to reopen. During such an uncertain time, I'm also committed to making sure that millions of Virginians with pre-existing conditions remain covered by their health insurance, and I will keep pushing back against any attempts to dismantle our healthcare system or halt the progress we've made here in Virginia over the last few years with Medicaid expansion. I thank you for joining us this evening, and after a brief introduction, I will invite Dr. Oliver to share a few opening comments of his own. Dr. M. Norman Oliver is the Commissioner of the State Department of Health. Prior to this appointment, Dr. Oliver served as the Deputy Commissioner for Population Health for the Virginia Department of Health. And before accepting that position, he was the chair of the Department of Family Medicine at the University of Virginia School of Medicine. Dr. Oliver has a long record of accomplishments studying health inequities, particularly as it impacts racial and ethnic minorities. This has been the focus of much of his research, as well as a goal and a point of attention for the health department he runs. Dr. Oliver attended the medical school at Case Western Reserve University, where he also obtained his master's degree in medical anthropology. He trained in family medicine, and he practiced broad-spectrum family medicine in rural Alaska for 2 years before joining the UVA's Department of Family Medicine in 1998. I'm glad to have him join us tonight, and Dr. Oliver, I turn it over to you for any opening comments.
Thank you very much, Congresswoman Spanberger. I really appreciate that kind introduction. I'll just spend a few minutes with some opening remarks because I'm really looking forward to hearing the questions from those who've taken time out of their day to attend this telephone town hall. We're all very eager to open up Virginia and get back to some kind of new normal in our lives. I believe that it's important, however, for us to realize that while we are opening up, that COVID-19 hasn't taken the summer off. I want to commend the citizens of Central Virginia and the entire Commonwealth for their excellent work over these past several months. It's because of your actions of maintaining physical and social distance from one another, wearing masks, washing your hands frequently, checking your symptoms, and making sure that if you're sick, you stay home. Those activities on your part is what kept the virus largely in check here in Virginia in comparison to the outbreaks in some other states. As we open up, we can expect cases to increase, and we have begun to see that in some regions of the state. There's a couple things that we can do to try to keep a lid on COVID-19 going forward as we attempt to open up more. One is to continue doing what you have done in the past, wearing your mask, washing your hands, maintaining physical distance from one another as much as possible. The other thing is on us at the Virginia Department of Health, which is to increase testing on the part of the state and also with our partners and commercial labs, identify people who are COVID-19 positive quickly within 24 hours, isolate them so that we can minimize the number of people that they expose to the virus, be able to find out who they have exposed and get those people into quarantine, and in that way box in the virus and keep down the spread of the disease. So if you get a call from one of our case investigators, please answer the call. This is what it's all about. I mentioned that cases have been increasing. If you go to our website at vdh.virginia.gov and look at all the data that we have there, you will note that most of the state is in what we would call minimal community transmission of COVID-19. Cases are decreasing or at worst have plateaued. In the eastern region, which comprises the peninsulas, the Tidewater region and the Eastern Shore, cases have been increasing markedly over the last 2 to 3 weeks. If you delve a little deeper into that data, you will find out that is really just the Tidewater region. Eastern Shore and the peninsulas, in fact, are not. The one peninsula with Hampton and Norfolk and out through to Newport News is seeing market increase in cases, as is Virginia Beach, Portsmouth, and Chesapeake. We've taken note of that, and we'll, as you may have heard from the governor's news conference yesterday, we will be more strictly enforcing the phase 2 guidelines to try to put a lid on this spread, and we are looking at the possibility of other restrictions that might need to be put into place. We do not want to go the route of some of the other states that have seen really a market increase across the entire state. This is a town hall for Central Virginia, and I need to point out that Central Virginia doesn't have substantial community spread, but it is still an area where we have seen, particularly in Richmond, Henrico area, some increases in cases, and we need to keep our eye on that. Congresswoman, I think I'll stop there and leave plenty of time to get questions from your constituents.
Wonderful. Thank you. At this point, I will turn it back over to our moderator and begin the questions.
Thank you, Congresswoman. Our first question is a live caller, Rebecca from Midlothian. Rebecca, you're live.
Yes, I am. Thank you. Congresswoman Spanberger, yes. I don't necessarily have a question. I have a comment, and that comment is, Virginia was one of the few states who saw a spike in COVID-19. And, I have a daughter that lives in South Carolina, in Somerville, which is, close, not necessarily close, to Myrtle Beach. And I have a son who lives in Texas. And both of those states have seen spikes. And, I know that we were expected to see spikes, but it really concerns me about Virginia because we have been very, very, we've masked and we've done our social distancing, but since the spikes seem to come from Hampton Roads, I think it's coming from Virginia Beach. And I think that we need to close the beaches. And I think that Virginia needs to have some type, not arrest people, but fine them, find them, for not wearing masks, for not social distancing. And I'm wondering if there's anything, in the books that would make us do that, because I'm being very, I'm going by all the rules, and it really, really upsets me to think that people going to the beach are concerned about wearing a mask because it affects their suntans,
Well, Rebecca,
Rebecca.
I appreciate your comments very much, and I think that some of the frustration and the concern that you're voicing is probably shared by many of the callers on the phone. I am going to invite Dr. Oliver to give his comments both as a physician and as the Commissioner for the Department of Health, but I did want, as a federal legislator, I do look a lot at how Virginia is stacking up across the country. And notably, our increase rate or our COVID rate is significantly lower in terms of how we're seeing increases compared to other states. Of course, I want to ensure we reach a point where it's always on a downward trajectory. So we as citizens who are wearing masks and who are being careful are doing a lot of things right. But we certainly need to continue to do those things, to do them aggressively and ensure that we actually move our rates lower. Unfortunately, there are some tremendous increases that we're seeing in some of the states that you mentioned that are deeply, deeply worrisome, given the major impacts that they have on public health. But Dr. Oliver, would you like to comment on Rebecca's comments and her questions regarding what we can do moving forward to ensure Virginia's on that downward trajectory?
Yes, thank you, Congresswoman. Rebecca, thank you for your comment, and thank you for being among the many Virginians who have been doing the right thing, wearing their masks and maintaining social and physical distance. I would say that the overwhelming majority of people are doing that. You are right that the spike that we're seeing in Virginia right now is primarily driven by Greater Hampton Roads region. And we've taken note of that. I've instructed the local health departments there to really apply the Phase 3 guidelines very strictly. Within those guidelines, there should be no congregating at bar areas and restaurants. Crowds are not supposed to be larger than 250 people, and there are other things along those lines. We're working with our colleagues in the Virginia ABC, also the Department of Agriculture and Consumer Services, which regulates grocery stores and other food like farmer markets, that sort of thing. And we're doing that so that we can visit those places and enforce these guidelines. As it turns out, just in the same way that on the individual level, the majority of Virginians are doing the right thing, that's also true of the establishments like the bars and restaurants in Virginia Beach and Norfolk. What we want to do is ensure that the ones that aren't doing that, that are allowing large crowds of people who are not masked to congregate, we want to stop that activity, and we will enforce that activity. We will enforce those guidelines through suspension of both restaurant permits and ABC licenses. And we've started that process as of yesterday. I'm also in the process of hiring about 100 more inspectors to help us with this enforcement. The executive orders that the governor and I signed for the Phase 3 lists violation of those guidelines as a Class 1 misdemeanor, which carries a heavy fine. I think that as opposed to trying to arrest individual people or levy heavy fines on individuals, that if we get at the institutions like bars and restaurants that are allowing this activity to take place, that we will have a bigger impact. And that's our plan right now. I mentioned at the onset of our conversation that we are looking at other things that we could do. We are looking at things like, for example, a curfew, stopping liquor sales at a certain time and shutting down the bars and restaurants a little bit later, reducing social gatherings from the 250 limit that we have now, taking it back to limiting it to gatherings of no more than 50, and other things. So we'll see. We're keeping our eye on this very closely because, like you, we do not want to see this go the way of Texas.
Thank you, Dr. Oliver. Just a reminder, this is an interactive healthcare-focused forum, and we'd love to hear your questions. If you have a question, you can press *3 on your telephone keypad at any time to get in queue to ask a question. A member of Congresswoman Spanberger's staff will collect your questions, and we will answer as many as we can during this live event. Again, press *3 on your keypad at any time to get in queue for asking a question. If you're participating online, you can submit your question below the streaming player. All right, at this time, we'll go to our next live caller. That'll be Christine from Locust Grove. Christine, you are live.
Hello. I have, I guess, more question about what happens when these students are sent back to school and some of the students are tested positive for COVID. My concern is with all of them going back. I live in Orange County, and I know every county is different for their scheduling for schooling. But this is, highly irregular time right now, and I know everybody's trying to figure out the best plan. But with trying to get these kids to school on the buses, trying to have them social distance in school, it's kind of not realistic. The high school that we have here in Orange County is almost 70 years old, is built in the 1950s. They are over capacity. The kids are packed in there like sardines. So my concern is, how are they going to social distance these kids to keep them healthy and safe? And, you know, what are they going to do when some of the kids do test positive? Are they going to close down the schools? You know, is there a plan? There's pretty much no information we're getting here.
Thank you, Christine.
Christine, thank you so much for your question. I have 3 school-aged children who attend public schools in Henrico County, and as a parent, I find the current circumstance to be just as concerning as you clearly do. I thank you for raising this question. This is a question that we have been hearing in our office very frequently. A lot of calls, a lot of letters to our office expressing basically concern about moving forward. So I'm going to address 2 things, and then I'm going to welcome Dr. Oliver to provide his point of view and his comments on what he knows to be happening at the state level. So a couple things. I have, from a federal perspective, I have 2 priorities that I'm looking at as it relates to kids in school, primary priorities. One is, in the event that kids do not go back to school, we need to ensure greater access to the technologies that will allow them to maintain contact with their schools. When schools closed down across Virginia in March of this year, it created many, many challenges for the communities that are part of the 7th District. In some places, we have pretty expansive internet connectivity, and in some places, we do not. And for this reason, I have been advocating for loosening of the regulations related to a program called the E-rate program, so that E-rate funding can be used to ensure access to hotspots and technologies that would allow for kids to access internet, not just at their schools and libraries, but also in their homes. I've also been advocating for greater funding to that program, and in a larger spectrum, or in a larger effort, I have been part of a major effort to bring internet coast to coast. These are things that fall in the category of how do we adapt when the kids aren't in school. But getting to your question about what happens if they are in school and the concerns that we have there, from a federal perspective, I'm focused on testing availability, ensuring funding for testing if that additional testing and funding, or if that additional funding must come from the federal government, and the provision of personal protective equipment, masks and basic gowns, sanitizing equipment, and the components of tests that are necessary for us to be confident at the point that children do go back to school, that children and teachers and custodial staff and administrators and cafeteria workers, that they can be safe at school. Locally, those decisions are being made by local superintendents and school boards, but my role as a federal legislator is to ensure that any time I can help bring resources from the federal perspective to the localities, I'm doing so. I continue to work, and this is a bipartisan priority, to provide relief funding to our localities. That will be particularly important for our schools at the point in time when they open up. So those are the things that I'm looking at from a federal perspective, and now I'll welcome Dr. Oliver to provide comments, and as a physician and as someone who's a little bit more knowledgeable about what is happening in the sorts of conversations, though notably I'll note he is not responsible for the decisions about when schools do open. Dr. Oliver?
Thank you, Congresswoman. At the state level, the Department of Education and the Virginia Department of Health have worked very closely together. The DOE has drafted plans and guidelines and sought our advice on what should be in these guidelines. The guidelines are very high-level, broad framework types of guidelines to help local health departments as they think through the more specific plans of how they would implement reopening the schools. And so from that point of view, the guidelines that we've worked with the DOE on trying to develop are not prescriptive or highly directive about what should be done. That's left up to the local school boards. I'm very glad to hear Congresswoman Spanberger say that she is working with others at the federal level to look toward getting more resources for the schools. I think we would all agree that in general they are under-resourced, and in facing this pandemic, that's particularly the case. The broadband issue is a huge one, with many thousands of children unable to take advantage of distance learning. So any help we can get in that regard is greatly appreciated. The Virginia Department of Health has 35 health districts and about 129 local health departments. And those local health departments work very closely with others in their local jurisdictions, including the schools. And we will do everything we can to partner with the schools in developing plans to address some of the things, Christine, that you raised. What to do if a child is found to be COVID positive. What do you do about the others who may have been exposed? And we will be working with the school boards and local school officials and individual schools to do our best to protect the community. I think that being able to speak out at a town hall like this is important. I imagine you have, or hope that you've had the opportunity to let your voice be heard to the local school board and superintendent. I think that voice is important. They need to hear from the parents. They need to hear from the teachers, so that whatever plans the local boards develop, it really speaks to the desires and concerns of the local community. This is important because things are very different from one community to the next, and it would be impossible really for us to come up with some guidelines at state level that would apply across the board to all school districts. So those policies need to be made at the local level, and your input is absolutely critical to ensure that those guidelines really meet your needs.
Thank you, Dr. Oliver. Just a reminder, if you'd like to get into queue to ask a question, press star 3 on your keypad if you're on the phone. If you're streaming online, you can submit your questions below the streaming player. And if you'd like to continue to receive updates via email, please press star 6 on your phone keypad at any time, and an operator will collect your email address. At this time, we're going to go to an online question from David. The question is, the Trump administration has mandated that hospitals sidestep the CDC and send critical information about COVID-19 hospitalizations to HHS. This is very concerning from a public health standpoint. Is there anything you can do to stop this?
I want to thank David for this question that he submitted online, and I will go ahead and take this one, though if Dr. Oliver wants to make any comments, he's welcome to, but this is a federal issue. So I have significant concerns about this shift. And for those on the line who may not have read about it, the administration has now mandated that data from hospitals related to outbreaks across the country will no longer be directed to CDC, that it will now be directed to a new HHS site that was just recently created by a private company in the past few months. I find this to be incredibly concerning because it will invariably change the trajectory that we are on for the ability of researchers and those looking at tracking the coronavirus, the ability to look at that data I have significant reservations about why this shift would be made in the middle of the pandemic. Notably, the administration hasn't demonstrated a very solid strategy for reporting data, and I have significant concerns about the level of accountability for public reporting that we will see with this shift. In terms of what steps as a member of Congress I could take to stop it, I certainly will be engaging, as I know my colleagues have started to do, with Health and Human Services, with the administration to determine why this change has been made, why it was deemed necessary, and if there remains a commitment to transparent data that will allow researchers and physicians across the country to be able to track the pandemic and the hotspots and the risks that we face. But I do share the concern. The announcement is relatively new, but I will be following up on this change very, very closely and watching it closely to ensure that it doesn't have any negative impacts on our ability to respond to the pandemic.
Okay, our next caller is Glenn from North Chesterfield. Glenn, you're on live.
Thank you so much. Thank you, Congressman. My question may be more directed at the health officer. I'm not sure. The concern I have is it looks like the 7-day rolling average of cases is going up and maybe even accelerating. And I know we've got contact tracers. I'm just curious to know how rigorous our contact tracing program is in the ability to track these folks down who have the virus and prevent further spreading, because right now it looks like we're seeing more community spread and an accelerating 7-day average.
Glenn, thank you for your question. Dr. Oliver, can I refer this one over to you?
Yes, Congresswoman. Glenn, you're absolutely correct. The cases are increasing, and they appear to be increasing at a more and more rapid rate. If you dive deeper into that data, you'll find that the majority of that increase is owing to market increases in the Tidewater area of the Commonwealth, specifically Virginia Beach, Portsmouth, Chesapeake, and Norfolk. You point to the importance of the contact tracing, and I agree that one of the most important ways in which we will be able to keep a lid on the spread of COVID-19 is to identify cases early. Our contact tracing team has a goal of identifying and talking to cases and getting them in isolation within 24 hours for 90% at least of those cases. As of today, we're approaching that. Last time I looked at, we're around 88% or so of the cases being identified within that time period and put in isolation. Likewise with contacts, we want to get them into quarantine within that same period of time, and the numbers are around that level. That becomes increasingly difficult with the number as the number of cases increases. So that's why we have to be really vigilant about what's going on in Tidewater, and I think be more strict in applying the guidelines and consider other restrictions. If the cat's out of the bag and we got widespread community transmission of COVID-19 going on once again in the Tidewater region, it will take more than just strict enforcement of the Phase 3 guidelines, and we'll have to think about instituting other restrictions. The governor is quite willing to do that if necessary, so keep your eyes peeled. We're watching the data closely, and we will take action to box in the spread of COVID-19.
Thank you, Dr. Oliver. Our next caller is James from Gordonsville. James, you are live.
Thank you. Representative Spanberger, first let me say thank you. We just had high-speed cable installed in our neighborhood this past week. I know that's an effort you've been working on, and it's very important to both me and my family, and I think Virginians as a whole, particularly as we deal with this thing. So quick aside, thanks. My primary question is, when I'm looking at the data rates that Johns Hopkins provides on state testing rates, Virginia is still in the bottom third, and I'm looking at their current as of July 25th or July 15th, 2020, and what I'm seeing is we're in the bottom third of testing rates, but we are literally in the top, not far behind places like Arizona in death rates, which are 23 per 100,000. And so my question is that it seems sort of disconnected, to me at least, when we're talking about going back to school, when our testing rates are so low and yet we're seeing cases go up. To me, that builds in an issue in terms of how much confidence do we really have in what we're having if we're not adequately testing the way a lot of other states, including some of the ones that are being more highly impacted, but we're much slower to adopt testing early on. That's a real concern to me, and I'd kind of like to know how we're dealing with that. The side question, this is probably for the gentleman from the health department, is again, I'm also concerned about the consistency in reporting from the health departments upwards. How many of them are literally regarding cases as if it's positive with COVID, that those go up as a COVID case versus looking at underlying conditions and classifying deaths and or illnesses based on other things rather than whether or not there's COVID involved. So those are my questions. I appreciate your time.
Thank you so much, James, and congratulations on the internet installation. That's exciting. I also appreciate your very detailed questions. I'll speak to the federal perspective in terms of the support that we've been ensuring that Congress has been appropriating. So the focus on testing at the very early stages, it was clear that you can address a problem when you know where it exists. So testing was a major component of all of the relief packages that we have passed on a bipartisan, bicameral basis, signed into law. We have appropriated more than $30 billion overall to support improved testing and contact tracing or surveillance capability. Those funds can also be used for the development of new tests. And this is over 4 different bills that we have allocated these funds. Notably, Virginia has received $241 million in federal support related to testing and testing plans of the overall dollar amounts that we have appropriated for to support states and their testing capabilities. There was $1 billion that went to CDC for them to develop their further contact tracing programs. And then there were additional programs to support rural health clinics and community health centers, and also to support the development of serologic and diagnostic testing. Notably, though this has not moved forward yet as towards potential law, there are multiple efforts and proposals in the House of Representatives and in the Senate as well that would enable us to strengthen our contact tracing numbers. And this gets, I guess, a little bit back to Glenn's question before yours, James. There's one proposal, and I'm supportive of this. It's got bipartisan, bicameral support that would take AmeriCorps volunteers and allow for them to train as contact tracers, ensuring that as we are testing and aggressively testing more people, that we also have the resources to be able to conduct the contact tracing that Dr. Oliver was talking about. So from a federal perspective, we have appropriated dollars to support testing. I am personally of the opinion that we need a more aggressive federal response from the executive branch. Despite not having that, it has been up to the states to respond individually. So noting my commitment to ensuring significant testing and contact tracing, I will pause there and invite Dr. Oliver to comment specifically on Virginia's testing rate and what our trajectory and plans are moving forward for continued testing here in the Commonwealth.
Thank you, Representative Spanberger. As James points out, on that Johns Hopkins list, we are in the bottom third. We used to be, I think, second to last on that list, as I recall. Early on in the pandemic, along with many others, we found ourselves having difficulty getting testing supplies, and were only able to test limited number of people who were symptomatic. With the support of the federal government, as Congresswoman Spanberger just talked about, there were increased funds that we were able to utilize to tap into other resources to supplement our testing supplies. We began to ramp up our testing, and I'd say over the last couple 3 months have radically changed our ability to test. So we went from being able to test only several hundred a day to yesterday we posted 17,000 or so PCR tests. We were over 14,000 today, and it keeps going up. We will be testing somewhere around 30,000 by a day by September. So we're greatly increasing our testing capacity, utilizing some of the support that we've received from CDC and from the funds that have been provided through HHS. That being said, I agree we have to work diligently to make sure that we really fulfill that promise of increasing the testing. I think that we will. There was another aspect to your question I have to admit that I blocked on. I don't know if James is still on the line.
Nope, James is off.
Okay.
Thank you, Dr. Oliver. I think we'll go to our next question. It's an online question from Mindy. What is happening at the federal level with the Affordable Care Act, and in particular, the cost of drugs and status of pre-existing conditions?
Thank you so much. I will take this one. So at the federal level, there's a couple things that I would want to mention. So first and foremost, the administration continues to file lawsuits against the Affordable Care Act. And I'm sure as many listeners know, the Affordable Care Act is the healthcare system that has provided healthcare to millions of Americans who choose to get their health insurance through the exchanges. It also has many elements that are part of that program, such as allowing individuals to stay on their parents' health insurance until the age of 26. Certainly during a pandemic, that has been very valuable for our younger workforce. Protecting those with pre-existing conditions, so you cannot lose your health insurance or be denied health insurance because of a pre-existing condition. Eliminating caps on lifetime usage, so this is particularly important to those who face significant health challenges or babies who are born premature and utilize a significant amount of health care early in their lives. These are all the components of the ACA that are incredibly important. Medicaid expansion here in Virginia was part of that. And in fact, there are about 50,000 Virginians in the 7th Congressional District who have health insurance thanks to Medicaid expansion. And again, during a pandemic, this is vitally, vitally important. So the administration continues through the Department of Justice to try and get the ACA to undo the ACA and the protections that it provides to Americans. in Congress, in the House of Representatives, we continue to fight those efforts. Notably, we also, as your question related to healthcare, but also to prescription drugs, so I'll mention one more thing on the healthcare front and then go specific to prescription drugs. We passed a bill in the House of Representatives that's called the Patient Protection and Affordable Care Enhancement Act that we just passed about 2 weeks ago, which would lower health coverage costs, negotiate for lower prescription drug prices, and expand coverage across the country. There's multiple other elements to it, but this bill did pass the House of Representatives with bipartisan support. We're hoping that it gets a vote in the Senate, but I don't see that happening in the immediate near term. As it relates to prescription drugs in the House of Representatives, we also passed a bill called the Lower Prescription Drugs Now Act, very aptly named. One of the major components of that bill allows for Medicare to negotiate its prescription drug prices. So currently, Medicare does not have the power to negotiate for prescription drugs, which hurts Medicare recipients and by impacting the rates that their drugs cost. Notably, this is something that President Trump campaigned on, allowing Medicare to negotiate its prescription drug costs. We did pass a bill a number of months ago. This was the primary element of it. Not only does Medicare have the ability to negotiate its prescription drugs, its prescription prices under our bill, but those negotiated rates would be extended to those who have commercial insurance. So this is an incredibly important step forward, this bill that we passed in the House, to lowering the cost of prescription drugs, making them more competitive, allowing competition to actually occur and bring down those costs. And notably, it's something that the President has previously, at least along his campaign, had said that he was supportive of. So it is my hope that perhaps we will see movement on that. I have been focused on transparency in drug pricing. One of the major challenges we face when it comes to drug pricing is we don't know why it's so expensive, and there are a number of elements from the point that a physician writes you a prescription to the point that you pick up your prescriptions at the pharmacy that may contribute to that price trajectory. I had a bill that I introduced, bipartisan, with a colleague from Texas. It passed with not only bipartisan support, but more than 400 members of Congress. In fact, no one voted against it because it requires that the pharmacy benefit managers, so a middleman along that route from prescription writing to prescription in your pocket, that they have to declare any of the rebates or vouchers that they may provide. So some of the pricing gimmicks that may drive up prices for those of us who require prescription medication. That bill passed again with unanimous support, and I'm looking forward to it getting a vote in the Senate. And I've also been focused on biologics, biosimilars, so generic versions of biologic medication, and generics, and getting generics to market as quickly as legally permissible, and ensuring that prescription drug companies can't engage in anti-competitive practices that may slow that down. So kind of the short answer to that is there is a lot happening as it relates to healthcare. First and foremost, I am focused on trying to protect our current healthcare system from the current efforts to undo it, but we need to enable the negotiation of prescription drugs for Medicare. We need those negotiated rates to be transferable to those who have other commercial providers. And, frankly, it continues to be such a primary issue that we hear about in our office, families and individuals who are making life decisions based on the prescription drugs that they require, who are choosing to take their medication in a way that it wasn't in fact prescribed because they can't afford to follow the prescription. It is dangerous, and it is a problem, and it is something that I continue to work to fix. Thank you for asking this question. And we will continue to provide information on our focus, or my focus, on lowering the cost of prescription drugs and certainly protecting health care, particularly for those who have pre-existing conditions.
Thank you, Congresswoman. Our next call is from Bob in Manikin-Sabat. Bob, you are live.
Thank you for taking my question. And Dr. Oliver, I want to thank you for you and your team's efforts in fighting this pandemic. And Congresswoman Spanberger, your efforts you described about getting the ridiculous cost that is built into the system through lack of negotiating power of the government. The government healthcare systems is very laudable, and I hope you are successful. My question has to do with the response times that we're seeing on getting test results back, because if it's as slow as it was when I had a test done in April, which took about 7 days to get a result back, no matter how many contact tracers you have and all kind of technology they have available to assist them, you'll be overwhelmed if it's that slow still. And the other thing I know that Dr. Oliver talked about getting up to 30,000 tests a day. That's still a fraction of 1% of the Virginia state population. It seems that that level is still not going to be adequate to ensure people can work in safe environments reliably, or in school environments, or any other institutional environment where they're inside for protracted periods of time. What efforts would it take in a state that is much better off than most states fiscally to either use private industry in the state or elsewhere to create more supplies, more lab results? I mean, it just feels like there should be some ability to solve this testing issue, even if we have limited resources from the federal government available to us, just within the state and all the smart, intelligent people we have in the universities.
So, Bob, I'm going to go ahead and begin answering this question, and then I will open it up if Dr. Oliver wants to comment. Some of the challenges, and Dr. Oliver did speak to this in a prior answer, some of the challenges that Virginia faced relative to testing at the very beginning was not so much focused on the resources to purchase the equipment or purchase the tests, but in fact the inability to buy the tests, regardless of dollars. This is from a federal perspective is where we had some of the challenges related to national stockpile issues, and particularly the reagents necessary to conduct the tests and the nasopharyngeal swabs. So from a federal perspective, in addition to some of the discussion points I've mentioned as it relates to, ensuring that there's federal support in terms of dollars, supply chain issues have been a new and major focus of mine as we're looking at the resiliency of our ability to react to potential waves into the future, but even importantly, as you mentioned, our continued efforts to test more people. And so I would just say from a federal perspective, I have co-led on efforts to advocate for use of the Defense Production Act. I've also co-sponsored legislation focused on looking at the resiliency of our supply chain, particularly as it relates to items that are produced overseas and over which we, the United States, doesn't have significant control, and in particular nasopharyngeal swabs coming from Italy, which of course was very hard hit with coronavirus at the beginning, or PPE, which much of it comes from China, including regions that was very hard hit at the beginning of the coronavirus. So from a federal perspective, in addition to funding, I'm focused on supply chain issues and ensuring that our country is pursuing strategies that allow us greater resiliency into the future. But I'll pass it over to Dr. Oliver if he wants to talk about the specifics of what Virginia's doing and the trajectory Virginia's on with testing.
Thank you, Congresswoman Spanberger. First of all, I want to say thank you for what you're doing, because a lot of what hampers us is the supply chain. And to the extent that there are efforts at the national level to provide the means to produce these items here in the states that will allow us to more readily get access to those things. It's pretty much, it's like my granddaughter's into the British baking show. It's like putting together a chocolate chip cookie, right? So you go to make the cookie, and sometimes you're short on chips, and then you have to wait for chips, and then other times you don't have enough flour, and then other times you don't have enough sugar. So that's what's been going on with these tests. For a while we were having problems with reagents, and we were having problems getting swabs. There's a lot of problems right now with pipettes needed for doing the testing, or the viral transport medium that you need to put the swabs in. So one thing or another that gets in the way of being able to have a complete test kit. As cases have been spiking around the country, more than somewhere around 22 states now, what you're seeing is there's obviously a lot more demand on the testing, and labs like Quest and LabCorp, the big commercial labs, are being swamped. And just as Bob mentioned, while we for a couple months now, we've seen the turnaround time going down to something reasonable, like 3 days to get your results, and now it's climbed back up to that week period. And I agree with him; that's just not sustainable. We're doing our best with our partners. We've worked very closely with Virginia Commonwealth University, University of Virginia, and Virginia Tech, Fralin Institute, to ramp up testing capability using coronavirus relief funds from the CARES Act. We're launching a program to ramp up the ability of those universities working in conjunction with the state lab to greatly increase the amount of testing kits that we have available every day. We plan on more than quadrupling the number that we have. I agree 30,000 is not it's not what we would hope for in terms of what would be absolutely ideal, but it is in fact a good number. If we do that every day, then in a month we will be testing about 6% of the population, and that will be enough, I think, for us to keep a lid on things.
Thank you, Dr. Oliver. We'll go to our last live question from Gwen in Henrico. Gwen, you are live.
Hello, thank you so much. And Congresswoman Spanberger, thank you for everything that you're doing for the 7th District in this issue and in others as well. My concern is with the folks that are in our elder care. It seemed to me that a lot of the deaths that we had originally, a large portion of them were coming from that aspect of our district. I'm wondering how they're doing, what's going on with elder care, the folks in those homes, and are they getting tested? Are they getting care, and have the numbers calmed down? And again, thank you as well, Doctor, for all that you're doing for our citizens.
Gwen, thank you so much for your question. The issue of how we are helping our neighbors in nursing homes and long-term care facilities is one that has been a focus of mine pretty much since the beginning of this pandemic. Our district, the 10 counties I represent, face the greatest challenges in our nursing home and long-term care facilities, and in fact, we saw tremendous outbreaks and tragic loss of life, and it has been a priority of mine to ensure that no additional families experience the loss that was felt throughout a number of our counties as COVID-19 swept through some of our nursing homes and long-term care facilities. Just to speak a bit to what's happening right now, there's the issue of those who are in nursing homes and long-term care facilities. There is very, very limited access to residents, and CMS released guidance back in May that said that nursing homes could begin to lift some restriction in phases in order to keep their residents safe. In June of this year, the Virginia Department of Health elaborated a bit further with specific guidance for nursing homes across Virginia, explaining how facilities should implement screening, require face masks, designate and isolate parts of the facility to ensure protections for residents. And it is important entering phase 3 in Virginia, because that is the point in time when visitation would be allowed, with particular provisions and significant efforts to keep nursing home residents safe. I will say that one of the concerns, I have had multiple conversations with medical directors of nursing homes, with nursing staff within nursing homes, talking about the impact of COVID-19 on their function, but also their residents. One of the concerns that's been brought to my attention is the actual issue of isolation, the very isolation that's meant to keep them safe. Has a really heartbreaking impact on residents, particularly those who might be suffering from dementia. And so to that end, while it isn't the same as an in-person visit, I have been focused on ensuring telehealth access, and I'm a co-sponsor of a bill that is meant to ensure telehealth services for a patient with their physician, but also importantly allowing for visits with family members using technology when there are still public health requirements that individuals not receive visitors at nursing homes. Across Virginia, just for reference, we are seeing, we note that it would cost about $8.7 million to test every nursing home resident and staffer in the 287 nursing homes that exist across Virginia. And VDH, and Dr. Oliver can speak to this, the current guidance is to test staff and residents. And so, there's been a tremendous undertaking across many of our nursing homes and long-term care facilities to ensure the protection of those in those facilities. The CARES Act, which is a bill that we passed in Congress month before last, provided about $56 million for Virginia to support testing at nursing home facilities, part of that larger allocation that I mentioned earlier. And facilities have to comply with VDH guidelines in order to get those funds from the state. Notably across Virginia, and Dr. Oliver can speak to this a bit more, the testing has been undertaken by hospital systems and by National Guard to ensure that we're getting baselines across these facilities. And then just notably, I have been active on the issue of how much funding is going to support our nursing homes and long-term care facilities. Of the money that Congress allocated to support our health systems, nursing homes, and long-term care facilities, I was not pleased by the methodology of the distribution that CMS put in place, or HHS put in place, because it disadvantaged just numerically the nursing homes and long-term care facilities that I represent. So I've been very active communicating with Secretary Alex Azar about this issue. I also have had a one-on-one phone call with CMS Administrator Seema Verma, advocating for the importance of passing this CARES Act funding along to the nursing homes. And I continue to maintain contact with local facilities here. And I would want to say I'm grateful for every medical professional, the CNAs, the nurses, the doctors who are there day in and day out at our nursing homes and long-term care facilities, particularly when they're unable to have family members visit. They are doing tremendous work as with their patients and with their residents. And I'll continue to advocate to make sure they have the resources that they need. And it is my hope that moving into the future, we will see a transition for those residents to be able to have a bit of normalcy and a safe visit from family members in safe circumstances. Dr. Oliver, that was a bit of a lengthy answer on my part. I don't know if you have anything you'd like to add.
Yes, I would like to add a couple comments. It is true that the long-term care facilities house obviously our loved ones, our mothers, our fathers, grandfathers, grandmothers. They have lots of chronic conditions and are particularly vulnerable. So while they only made up about 24% or so of the number of cases, they were over half of the deaths that we had in the earlier parts of the pandemic here in the Commonwealth. The number of outbreaks in nursing homes and assisted living facilities has been declining over the last month or so, looking at the data, and that's a good sign. In addition, as Congresswoman Spanberger mentioned, we have received funding from the CARES Act to help us in getting baseline studies done to see the extent of the spread of the disease in skilled nursing facilities. And the National Guard has been used for that extensively. We've carried out these surveys in about 236 of the 287 skilled nursing facilities. Some were not interested in having the surveys done, either because they were doing their own surveys or just had no interest in doing it. We are going to, we've made a proposal to draw down more money from the CARES Act to hit the additional 64 facilities that we need to hit, and also to begin doing more work with the assisted living facilities, which haven't had as many outbreaks as the nursing homes, but still we feel deserve to have these testing surveys done. Thank you.
Thank you, Dr. Oliver. We're coming to the end of our time together. Congresswoman Spanberger, would you like to give us your closing remarks?
Yes, absolutely. Thank you so much to everyone who's joined us on the line tonight. Dr. Oliver, thank you for bringing your expertise and your experience from the Virginia Department of Health to this call. Thank you to everyone who's listened for your great questions. This town hall will be available on our website and on our Facebook page. If you want to go back and listen to any portions of it or share it with friends or family, I invite you to sign up for our newsletter. We regularly send out information that should be of interest and useful, including information related to the phases that Virginia is in and any Virginia-specific information related to reopening. Again, I thank you for your attention. I thank you for your engagement and thoughtful questions. I hope you and your family members and friends and neighbors are staying safe. And our office continues to be a resource for you. Please call us if we can answer questions or be of assistance. And I'm grateful for your participation this evening. Stay safe, everyone, and thank you.
Thank you for taking the time to join us for this important telephone town hall with Congresswoman Spanberger and Commissioner Oliver. We appreciate the opportunity to answer your questions. But if we were not able to get to your question this evening, you can call our district office at 804-401-4110 during normal business hours, or go to spanberger.house.gov. We will host more of these events in the future to keep you informed on what Congresswoman Spanberger is working on for Central Virginia. Thank you again. Stay healthy and safe, and have a good evening.